Hello, class. My name is J.C. Coleman, and this is my presentation for the Human Sexual Development class for summer of 2017. The title of my presentation is Treating Adolescents with Sexual Behavior Problems. Human sexuality Human sexual development is a very intriguing subject, as we all know. Now, the traditional thought is that males develop sexually into men and females develop into women. In recent history, many feel that people are able to have a right to decide how they develop sexually, are challenging the thought that men and women are developed the way that they've traditionally developed. Boys, of course, develop into men, and males develop into men, and females develop into women. It is becoming clearer that although gender influences sexual development, society and culture has a greater influence. Therapists and other clinicians have long sought answers when treating clients with sexual development issues. There are many studies which has different conclusions, but most can conclude the impact and influence of culture and society. Most of the studies that I've done preparing this research has come to that conclusion. Now, this paper that I'm writing will explore the development and treatment of adolescents who exhibit sexual behavior problems. And this paper will also make a distinction between treating juveniles and treating the adults. My subtopics that I will be using will include human sexual development and the influences thereof, parental relationships, and we're going to talk about each one of these individually, peer relationships, community, society, and cultural, pubertal development and biological sex, sexual orientation, social influences and constraints, clinical inference, the implications on counselors, interventions, and we will have a conclusion. Alrighty. Now, human sexual development. Many elements contribute to the sexual development of human beings. Although early childhood influences are relevant, however, adolescent relationships are more vital. These relationships include peers, families, and social circle. During this crucial period in social development, adolescents are heavily influenced by their close relationships. Research shows that there are four main types of relationships that influence an adolescent: parents, peers, community, and society. As a matter of fact, we're going to explore each one of these four influences. The first one is the parental relationships. Our first bullet, the parents and child conflicts. Now, children in the United States tend to have increased parent-child conflicts when they go through puberty. During this time, there is also a decrease in consistent family bonding. Now, there's a noticeable increase in arguments about things such as curfew, clothing, friends, and privacy. And as we all know, that when we were growing up, and those of us who have raised teenagers and children, as they grow up, the conflicts tend to increase on the things that they want to wear, because they think they know what they want to wear and what they should be wearing. But as parents, we have to step in and do some correction, and they tend to believe or tend to think that you're invading on their privacy, and even when they're picking their friends, even what time should they come in when they go out. This tends to be a struggle for control between the parent and the child. Friends who the parents disapprove of have a significant influence on the child, especially if the parents do not approve of the friend's values and the friend's behavior. Sometimes it's you have to walk a very shaky ground when you dealing with children and adolescents and preteens when you're talking about their friends, because sometimes the more you push them away from those friends, or you discourage them for being friends with these particular individuals, the more they want to gravitate toward those individuals. Parents are frightened by the unknowns, what can happen to adolescents as these adolescents are striving for freedom. Conflicts between children and parents tend to increase during adolescence, but these conflicts are usually because of minor issues. However, when it comes to making decisions about major life issues, many adolescents will share the attitudes and values instilled in them by their parents. When there's a good relationship between adolescents and parents, adolescents are less likely to engage in risky behavior, the behavior that other adolescents are engaging in, such as smoking, drinking, and unprotected sex. I guess in other words, what I'm trying to say is that it does not matter, regardless of what that influence that the teenagers have on your child. At the end of the day, good parenting will ultimately have more impact on a child than the children or their friends that they tend to gravitate toward. When it comes to making those life-changing decisions. Peer relationships, influences, the personal development, quality, good character. As adolescents work to form their identities, they pull away from their parents, and peer groups become very, very important to them. Cultural, well, during this time, peer groups become so important to them, and the level of influence that these peers have on the adolescents is very important, and it has a lot to do with their personal development. As they form relationships with various people, now they're tending to form friendships with these people. You know, sometimes lasting friendships. When I've got some friends that I've met when I was an adolescent, and we grew up together, and we're friends actually to this day. And I got to say that it had an impact on me just at that particular time in my life, you know, and in my development. Depending on the quality of these friendships, they can enhance a child's development, whether they are good character or not. Adolescents began to associate more with friends of the opposite sex more than they did as children. And their peer groups become larger, and they share common characteristics. Now, these peer groups allow the adolescents an opportunity to develop social skills such as empathy, leadership skills, and it teaches them about sharing. Now, this is good. This could be good in an academic setting. These groups can have a positive influence, such as motivation, and motivating that child to have better study habits and to want to do good and want to be successful. However, all the influences that these children or these adolescents get from their peers are not positive. There's also the possibility that the peer influence will be negative. Negative influences can attribute to bad decisions such as drug use, drinking, committing crimes, and other risky behaviors. Peer pressure could be positive, and it can also be negative. During adolescence, peer groups and peer pressures is more relevant, it's more prevalent in children. Adolescents tend to act more on emotions, and they tend to be more, have more emotional instability because, growing up, being as an adolescent, you're trying to figure out who you are, what you are, what is life about, many of their emotions are related to those hormonal changes. Now, these changes can be linked to physical and emotional aggression among peers. Now, research has linked these aggressions with a vast number of psychological difficulties, including depression. That explains why a lot of teenagers, a lot of adolescents tend to suffer from depression and other psychological issues because of the hormonal change that they go through and the chemical change that they're going through. Our next topic heading is community, society, and culture, social responsibility, sexual expression, belief system development, developmental factors varied by culture, lifestyle shape, socioeconomic factors, and the influences and the responsibilities. Many characteristics of adolescent development is rooted in human biology and their cognitive structures. However, culture also plays a very significant role. Individuals learn culture and they share it socially among their peers and acquaintances, and it affects all facets of their life. It affects how individuals approach social responsibilities, sexual expression, and belief system. All of these things are developed through community, social, and culture. The way individuals dress, their work ethics, how they entertain, and their language, all of these are products of their culture. There are many factors which contribute to the shaping of adolescent development, but these factors are varied by culture. The individual who is perceived as autonomous or independent is determined by their culture and varies from one to another, as do the behaviors that represent this emerging autonomy. The culture of an adolescent shapes the lifestyle of the individual, as well as the anticipated role and responsibility that they are likely to assume. Now, the sharing of family responsibility is a large determining factor in usual adolescent behavior. For example, some adolescents have to obtain a job to help provide for the family, whereas other adolescents come from more privileged environments where their responsibility affords them more freedom to do other things. Now, the socio-economic background of families can further influence the development of the adolescent and determines what is normal for a particular group. Good example is a good friend of mine who always worked on his dad's farm, and while we were playing basketball and football and baseball, this cat, he always had to work. And even to this day, he doesn't have a lot of time for social activities because his culture, the society that he was raised in, instilled in him that he has to work all the time, and it had a major influence and impact on who he is today. Pubertal development and biology. Interest in sex, risky behavior, boys' maturation, girls' maturation, hormonal, and testosterone. Now, the beginning of pubertal development in children stimulates an interest in sexuality and in sexual interactions. When boys and girls mature early, studies show that they usually engage in risky sexual behavior more often than those who develop later. Now, research on the link between personality and sexual development may therefore be overestimated if pubertal development is not included in as a control variable. That's when you're doing the studies on these particular children. They've got to they must include this. You must include puberty in a control variable. Now, during adolescence, there are also significant differences in boys and girls concerning sexual interests and behavior, partly due to differences in the hormone, testosterone, and physical maturation. However, although girls are found to physically mature at an earlier age than boys, they tend to mature earlier than boys. Girls in the United States initiate sexual behavior at a later age and have fewer sex partners during a lifetime. However, in the Netherlands, gender differences in age at sexual initiation have not been consistent and differ across the different sexual behavior. And next, as my phone rings, we have sexual orientation. Sexual orientation segment, we talked about gay and lesbians, gender identity, characterization, discrimination, and the psychological health. In recent years, the way society is viewing sexual development has changed. Although many still and will always believe that sexual orientation is a choice, studies show that there are other factors to be considered. Gay and lesbian interests and behavior appear to result from a complex interplay of genetic, prenatal, and environmental influences. Sexual orientation and gender identity develops earlier in males than females. Once it is identified, it is usually hard to change. Homosexuality is characterized by some as pathological and has oftentimes caused discrimination and hate crimes against gay men and women. There is bound to continue to be widespread disagreement over this issue. However, knowledge about sexual orientation and psychological development is growing at a rapid rate. Exciting work is being undertaken by many different investigators in various parts of the world with valuable results. Proponents of homosexuality will argue that gay men and lesbian women's psychological health is as sound as that of heterosexual men and women. Methodological difficulties in research remains with the continued needs for more delineated definitions of sexual orientation and empirically derived databases of population statistics of gay men and lesbians. In other words, there needs to be much more research done on gays and lesbians and their mental capacity or their psychological health as related to the sexual orientation. The social influence and constraints, positive or negative, repression, punishment, Middle Eastern, African, and in Western society and social stimuli affects human beings in every aspect of development, and of course in sexual development and in their behavior. Now, these influences can be positive or they can be negative in the development of human and sexual behavior. One such factor in society is repression and curtailing of sexual behavior of young boys and girls as a punishment. In some cultures, This lack of education about human development causes abnormal sexual development. The repressing girls' and women's sexuality prior to marriage has been a major focus of many Western, Middle Eastern, and African societies for this last millennium. But Western societies may not be as blatant in repressing girls' and women's sexuality prior to marriage as other societies. However, the practice does exist. In the United States, sexual repression of young people's sexual behavior is still ongoing. This repression has included passing state and federal laws and rules focusing on protecting underage girls by limiting their access to the morning after pill, by limiting their access to abortion services, and by limiting their access to immunization against the human papillomavirus, and restricting their access to male sexual partners of any age. So I think basically what we're saying here is that the social influence and constraints that's placed on sexual development is oftentimes due to a lack of knowledge and a lack of understanding. As in some homes, in some families, it's taboo to even talk about sex, and when children bring up that subject, they're being rebuked and scorned, and they're encouraged not to even talk about it, and that could cause some type of negative influence on their sexual development, and it will later show up in their sexual behavior. The clinical inference, challenges in treatment, the models used, the adults versus adolescents, other behavior problems, criticism, and cognitive behavior. Okay, the clinical influence. It is clear that the elements that influence sexual development of juvenile impacts the person's behavior, both positive and negative. Clinicians are challenged when it comes to effectively treating juveniles with sexual behavior problems. The gathering of information and studies in this field is not new, however, it is still in a developmental stage. In fact, this field still operates with the understanding that much of what is done in assessing and treating adolescents with sexual behavior problems is based on many assumptions. This is especially true regarding juvenile sex offenders. Now, the treatment of adolescents with sexual behavior problems is continuously being developed and has been growing over the past 25 years. Most of this growth is influenced by what is known for treating adult sexual abusers. More and more is noted that treatment models used for adult sexual offenders is being used for treating juveniles. Treating adolescents with the same models and methods as we do with adult sex offenders ignore the fact that these young people are a separate and distinct group of patients with individual differences and treatment needs. Now, in many cases, developmental and contextual issues have been ignored in working with this population. Most adolescents who sexually abuse have compulsive and or impulsive behavior patterns, and it is believed that some adolescents may have or are developing characteristics and behaviors that will indicate that they have sexual addiction problems. Most of the treatment programs for juvenile sex offenders follow the customary models and strategies of treating adolescents with sexual behavior problems. These treatments include, but are not limited to, empathy training, social skills, interpersonal skills, sex education, and anger management. Recently, some of the more traditional approaches to treating sexual abusers have come under criticism, including relapse prevention. The most widely used treatment model programs for treating both juvenile and adult sex abusers. Now, they use both of these. They use this model on both population of people, but they both lacked. They lacked relapse prevention methods to keep them from reoffending and relapsing back to that state. The work with juveniles with sexual behavior problems should be an approach which incorporates the customary and modified cognitive behavior programs with lapse prevention programs. It's not enough to treat them, but there's got to be methods or ways of treating them and addressing their propensity to relapse and fall back into that behavior. Implication on counselors. Now, there were studies during my research. I found that there were studies done that points out the implications. Counselors, abuse counselors, emotional abuse, childhood neglect, influential situation, and objectivity. We cover all of these areas are covered in this segment. Studies have been done to determine the impact adolescents' sexual behavior problems have on therapists who work with such clients. Now, in the studies, counselors were allowed to describe their own feelings and experiences in dealing with these adolescents. 4 themes arose out of the data that related to their discussion of their response to clients. The study revealed that many of the counselors who participated in this process has experienced different forms of sexual abuse during their lives. In each case, the subject knew the perpetrator. Now, these counselors who were abused believed that their abusive history gave them an uninhibited view of what the client has gone through. One female counselor who had been sexually abused by her uncle or an older brother, she said, you feel like your history helps you with the kind of sensitivity and understanding and lack of sensitivity and understanding because it goes the other way too. And I think that's a reality. Several of the counselors interviewed in this study shared that they had experienced sexual abuse as a young adult or as teenagers from peers or from a figure of authority. Although sexual abuse was the focus of the study, many of the participants were victims of emotional abuse and childhood neglect. The counselors report that the neglect they felt from their parents as a child was usually due to some issue the parents had, such as alcoholism or mental disorders. These situations provided some rationale into why they chose to work in the field as a helper. Now, Deborah shared how, for her father's emotional problems were a catalyst for her career as a counselor. She stated, I've not been sexually abused. I haven't been physically abused. My father had a psychiatric illness, which I think made me develop an interest in the sort of psychological area of care. That may have influenced my work. These therapists tend to believe their prior experiences is advantageous when working with adolescents with sexual behavior problems. However, those who have not personally experienced abuse express very different thoughts on this point and feel that abuse in a counselor's past could cloud their judgment. And several of them made statements regarding belief that having abuse in a counselor's past cloud their judgment and limit their ability to be objective. All righty. The next topic is interventions. We explored the target population, co-behaviors, lack of boundaries, distorted values. We addressed the trauma, methodologies, and theories. Children under the age of 12 with sexually abusive behavior problems are increasingly recognized as a target population requiring specialized clinical intervention. Research shows that children who engage in sexual abusive behavior is a product of an environment. Now, these environments lack appropriate boundaries which protect personal space and privacy. These children experience co-behavior, such as sleeping and bathing. They may have witnessed adult sex, porn magazines, adult videos, and access to explicit internet sites. Some children who were raised in family systems that were so strict that they were forbidden from talking or expressing anything concerning sexuality. Still, other children who engage in abusive sexual behaviors have often been exposed to distorted values about sexuality and have learned to associate sexual contact with themes of degradation, manipulation, aggression, and violence. If a therapist is going to have a chance at helping a problematic child, he or she must teach them to take responsibility for their abusive sexual behavior. They must also be taught how to deal with the trauma associated with their experiences and teach them coping skills to deal with their less than optimal family environment. Treatment approaches used with victims can help children with sexually abusive behavior problems address their abuse issues, while developmentally sensitive treatment approaches used to treat perpetration can help them be responsible for the ways that their sexual behavior harm others. In fact, it may be best to treat all children with sexual behavior problems, whether their behaviors are sexually abusive or problematic, by combining principles of play therapy and cognitive behavior interventions. Some research has been done on the use of mindfulness. Although mindfulness has become a mainstream methodology in mental health treatment, it is a relative new approach with adolescents and perhaps especially youth with sexual behavior problems. Nevertheless, clinical experience and several empirical studies are available to show the effectiveness of a systematic mindfulness-based methodology for treating adolescents who engage in sexual and physical aggressions. While theories on this etiology of sexually problematic and offending behavior have become increasingly developmental in their perspective, treatment approaches that are utilized to address these issues have not significantly changed to address this thinking. Conclusion. When treating the juveniles with sexual behavior problems, there are a lot of things that needs to be considered. Adolescents commit a substantial number of the sexual attacks against teenagers and adults alike. The beginning of the behavior in these youth is usually linked to factors which reveal their life experiences, contacts, and or developmental insufficiencies. Research submits that, as in the case of adult sex offenders, there's a telling difference between youth who target youth and adults who target children. However, there is a distinction between the juveniles and the adults. Many adolescents who commit sexual abuse may not necessarily become an adult offender. The research in this area is that it's developmental at best. More research is being done in this area, but there is still more research needed to understand the etiology of adolescents' sexual behavior problems. That concludes my presentation for this particular course and for this human sexual development class for summer of 2017. And my name is J.C. Coleman. I'm signing off from treating adolescents with sexual behavioral problems. Thank you. May God bless you and keep you.